Start.
Knock, knock. Hi, my name is Ivana. I'm going to be a nursing student today. I am going to be closing the curtains to provide privacy. I also already checked to see what I needed from the provider that was ordered to assess your wound. I am going to be doing my hand hygiene and also going to be putting the appropriate PPE as indicated prior. Alrighty, can you please tell me your name and your date of birth? Okay, I'm going to be checking your wristband for confirmation. It's about correct. I am going to be assessing the bed so I don't hurt my back. Can you please tell me if you have any allergies? No? Okay, so today we are going to be doing a wound care, so I'm just going to be taking off the gauze that you have on right now and putting on a new one. Alrighty, so I am going to be getting my setup table ready. I'm gonna be doing this, cleaning it, wiping it down. Okay, so move this down. Alrighty, I am gonna be peeling this the opposite direction of me. I'm gonna be getting my biohazard bag and taping it right here. It's not sticking. There we go. Okay, there we go. I'm gonna be also putting my trash can right next to it. Alright, I'm gonna be taking this off, my gloves off, and doing more PPE, sanitizing my hands, putting my gloves on. I'm also going to make sure my patient is at a comfortable position for me to assess her wounds. Okay, I'm going to be making sure I provide patient privacy, so I'm only going to be taking off the blanket and exposing the wound. Okay, so I am going to be taking the tape off. I'm going to be pulling on the skin on the opposite direction so I don't hurt her. I'm also going to be using sterile water to if the tape is sticking on. Beforehand, if I am going to provide absorbent pads so if anything can be absorbed at the bottom. I'm going to be taking this off. I'm going to be just observing and if there's any wounded, any type of drainage, the type and the amount. I'm going to be putting this in my biohazard. I'm going to be doing the same by the 4x4 gauze. I'm going to be taking this off, doing the same. I'm going to be observing the type of drainage and how much. I'm not going to be inspecting around the wound to see if there's any abnormalities. Everything seems to be looking fine. I am also going to be measuring the depth, the length, and the width. Okay. So it measures to be 2 centimeters. The width is 5 centimeters, and the length is 12 centimeters. I am going to be throwing this away in my biohazard, and then I'm going to be putting this right here, saving it for later. I am going to be taking off my gloves. And I am going to be opening up. I am going to be opening this up. Opposite, I'm going to be pulling on the corners and making sure it is the opposite direction of me. pokey. I am gonna be using my sanitized gloves. I'm gonna be pulling it away, making sure I can put not touching the glove itself, only touching what is folded. I'm gonna be touching the cuff again on this one and then putting it on. I'm gonna be throwing this away in the garbage. Alrighty, now I'm gonna be taking my gauze, dipping it in here, squeezing the excess, using this so I don't touch the wound itself. I'm gonna be packing it lightly and loosely, but still enough to cover it up. Now I'm gonna be throwing this away. I'm gonna be using my 4x4 gauze, making sure. And I'm gonna be using this. I'm gonna be making sure the blue side stripe is up and making sure it's 1 inch away from the thing itself. I'm gonna be taking my gloves off, but before that I have to before I did this I made sure that the area was dry. I did it very dry and then make sure to moisturize it around it. I am gonna be taping it. I also made sure to take any digital photos if needed. I am also gonna be writing down the name, the time, and the date that the one was made. I am gonna be throwing all my stuff away. Throwing this all away. I'm gonna be providing hand hygiene, making sure everything is tightly secured before covering up my patient again. Alrighty, I am gonna lower the bed all the way to the lowest for a comfortable position. And here's your call light, and I'm gonna do hand hygiene again, and I'll make sure to document the wound, the type of drainage, the color, the smell, and all the supplies that was used today, and also the tolerance that you were able to handle while I did the wound.